It's such a popular cancer, gynecological cancer, that anybody can get it. I was one of these people that, it never would happen to me, never. But it does, and it does happen to regular people. And you don't have to, have a symptom. I didn't have any symptoms with mine at all. It was just found with a normal cervical screening. So in 2021, I had my cervical screening test. Didn't think anything of it. And the nurse said that my cervix was inflamed, so I was sent off then for a colposcopy, which then in turn became a cervical cancer diagnosis at the beginning of 2022. My treatment was a hysterectomy, and I got the all clear the end of March 2022, which was brilliant. I think my advice to anybody is, if you receive your letter for a cervical screening, just book it. Don't throw it in a drawer. Don't do what I did and throw it in a drawer and think I'll sort that out later. It's understandable. We've all got busy lives. But if you get it, just book it. It's 2 minutes of your time. I think it's understandable that you're going to be nervous when you go for your screening. But there is nothing to worry about. It might be slightly uncomfortable, but what some people don't know is there is the option to use a smaller instrument, not just the generic size that they just use. So if the larger one has been uncomfortable in the past, ask for a smaller one. But it's 2 minutes of your life, and that 2 minutes could change your entire life. It was only until I'd had the diagnosis that I Googled what HPV was, and that's when I realised that HPV is the cell that, if your immune system doesn't clear whatever infection is on it, that then turns into an abnormal smear test. And that is what clinicians look for when you're having a smear test. It's for that HPV cell. If you don't have that, brilliant, you don't get a diagnosis. If you do have a problem, then it comes back abnormal, and they can sort it with medication. You can get a colposcopy. There's all sorts that they can do. I've got an Instagram account now that I raise awareness for cervical cancer. It's become quite an obsession of mine. So I put steps on what sort of symptoms to look out for, what happens at a cervical screening. There's all sorts of information on there. So if anyone is a bit worried about going for one, just have a look. It's so simple, and it's so easy, and it is so quick. 2 minutes saves your life.